But there is this idea that we are deliberately conservative because we don't want to harm patients. Well, I would say we really do believe that you should be in large part in charge of your own health. That we're in a different era now than we were in the 50s and 60s, where most of your healthcare encounters were because you felt sick. I do think that healthcare providers are mostly quite fat and happy with the current structure, and they're in charge, so why would they want to change? And they also have, which is important to mention because I don't ever want to make them out to be greedy and mean and filthy. They're just human beings. But there is this idea that we are deliberately conservative because we don't want to harm patients. We have this vision that you should be able to A, care for yourself, and B, engage with a healthcare provider when it's needed. Right now, the default is to always, in most cases, passively ask your doctor. I don't know, I see patients and I can't tell you how many of them say to me, I don't know, you're the doctor. Connected health has really taken an amazing leap forward in the last couple of years because of the promise that reimbursement is being re-architected. We didn't lobby for that or invent it, but it happened. Telemedicine tends to invoke images of video conferencing. It's really, of course, much broader than that, but when you're talking to folks who aren't in the industry, we find that it's a limiting term. So we took on the term connected health in the middle part of the last decade to try to invoke an image of using communications and monitoring technologies to achieve a much broader palette of services, including health and prevention, including, that was the pre-runner really of mobile health. So yes, I think that is the future of healthcare delivery, but not because of the smartphone per se, but because of the capacity for doing those things in just a whole new way. I would say it's ethically inappropriate for us as healthcare providers to ignore this whole new set of data, to just sort of be arrogant and say it doesn't exist, and I only want to see data when the patient's in front of me. So design is fundamental to the next generation of healthcare delivery, software, apps, and so forth. It's critical. We're really getting to the point where we'll know your risk very early in life and can really start to tailor programs just for you. That's a really powerful piece of the future, and it's a near-term future.